Hello dear students, I am Günel Əyyubova, Senior Lecturer of Department of Histology, Embryology and Cytology, and today we will continue our fifth lecture. Today I will introduce you the second part of this topic about the connective tissues. And today we will focus on the blood as a connective tissue type. Then we will talk about the skeletal tissues, cartilage and bone. As we know with you, the average person has approximately 5 liters of blood, which constitute 7% of his weight. The blood is fluid, reddish fluid, which circulates within the circulatory system, and it pumped by the heart into the vessel system. By that way, it carries nutrients, oxygen, electrolytes, hormones to the cells of the body, and it eliminates carbon dioxide, waste products. It takes away from those cells to be eliminated by the organs which are designed to perform those tasks. Then we have to know that pH of blood is 7.4. It participates in regulation of osmotic acid-base balance of the body and the temperature of the body. Besides, some of cells of the blood perform their functions within vascular system, but some of them, when they receive signal, they leave bloodstream, enter the connective tissues and perform their duties there. Also, blood, because it is a fluid, it has protective mechanism of coagulation, which is carried out by the platelets. Here you can see, for example, platelet. This will minimize loss of blood because of the damage of the vessel wall. The blood, if we will look at if we want to prepare the slide and to look at the blood under the microscope for microscopic examination, we prepare smear of blood by smearing the droplet of the blood on the glass slide. Then we perform its air drying. Then we have to color it by the specific staining methods. That method was introduced by Romanovsky in 19th century. He used mixture of methylene blue with eosin. Nowadays, popular is using the modifications, Ginza and Wright modifications of that method. By that way, we evaluate. We learn the blood cells based on their colors, which produced by those stains, by those dyes. How we will study the blood. Pay attention. If we will take 100 milliliters of blood and pour it into the heparinized tube, which covered by heparin. Heparin, you know, it is anticoagulant. Then we will centrifuge this tube in specific machine. Then the blood cells will be precipitated on the bottom of this tube. By that way, we will have 45 milliliters or 45% of this tube will be occupied by the red blood cells. It will be called hematocrit. Hematocrit, it is total volume of red blood cells. Then 1% it will be buffy coat, which produced by leukocytes and platelets. That will be just 1%. And the remaining will be fluid, which will remain on the bottom of the tube. It will 55%. So that will be the plasma of blood. So plasma constitutes 55% of the total volume of blood, in which we will see the content of the plasma. And if we will look at the content of the plasma, we will look in some table. We can see that the major component of the plasma, it is a water, which constitutes 91 to 92%. The remaining 10 to 8%, it's dry substance, from which 7, 8 to 9% is proteins of the plasma, which composed of albumins, globulins, and proteins which participate in coagulation of blood. Then other solutes here, we will see the electrolytes, hormones, nutrients, blood gases. They will constitute just 1 to 2% of the plasma composition. And we have to know that during coagulation of blood, some organic and inorganic components of plasma will leave plasma to form the clot. And the remaining fluid, which is straw colored, it will be called serum, and it will not contain clotting components which needed for formation of the clot. Then the plasma proteins, they will keep fluid. It will prevent it from migration to the extracellular space. Actually, the plasma components, non-proteinose component of the plasma, will leave bloodstream to form extracellular fluid. But these albumins will create osmotic pressure, which will decrease this amount of fluid which leave bloodstream. So they will be responsible for maintaining the low amount of the extracellular fluid. Now let's come to the formed elements of blood. These are, first of all, erythrocytes. They are smallest but most numerous cells of the blood. They are responsible for gas exchange. Their shape is biconcave, pay attention, and this biconcave shape will provide large surface area for the gas exchange. Their diameter approximately 6 to 7 micrometer, and when they maturate and develop inside of the bone marrow, they leave the nuclei and organelles. And upon entering the blood circulation, they do not have these components, cellular components, but they will include some enzymes, that is especially carbonic anhydrase, and this carbonic anhydrase will catalyze formation. Let's look here, that is in tissues, at active tissues, and that is in alveoli of the lungs. What is taking place here? Let's look together. In tissues, you know that carbon dioxide eliminates from the tissues, cells of the tissues, and through the endothelial lining of the blood vessels, it enters into the blood circulation. Here it enters the cytoplasm of the erythrocytes, and carbonic anhydrase will catalyze formation of, from the carbon dioxide and the water will be produced carbonic acid. It will dissociate into hydrocarbonate anions and hydrogen protons. The hydrocarbonate anions will leave cytoplasm via the chloride shunt. It means that, you know, that in the membrane of the cell of the erythrocytes we have anion exchangers. If you remember, we studied it in the course of the cytoskeleton elements. This anion exchanger will exchange carbon dioxide, the hydrocarbonate anions, with the chloride. Chloride will enter the cytoplasm of erythrocytes. So most part of the carbon dioxide will be carried via plasma to the lungs, capillaries. In the capillaries of lungs that are in close contact with the alveoli, that is the wall of the alveoli of the lung, it is also covered by squamous epithelium. Here what we will see, this carbon dioxide will enter the lumen of the alveolus, and oxygen will come and will enter the cytoplasm of the erythrocyte to bind with the hemoglobin. So main part, the bulk of the cytoplasm of the erythrocyte is filled with hemoglobin. That is the, we will look here. Hemoglobin is a tetrameric protein which include 4 globin chains, polypeptide chains of 4 globin molecules. These are proteins, each of which bind heme. Pay attention, that is the heme portion which contain ion. Here we have to know that we have 4 types of hemoglobin globin chains. They are alpha chains, beta, delta and gamma chains. Here we can see that in fetal hemoglobin there are 2 alpha and 2 gamma chains. Pay attention, the months of gestation, it is a hemoglobin of fetus. Then after birth, that hemoglobin is replaced by hemoglobin A, that is adult hemoglobin. It will include 2 alpha and 2 beta chains. That is hemoglobin A1, but in approximately 2 to 3% in our blood also we include hemoglobin A2, which include 2 alpha and 2 delta chains. That is 2 delta chains. And in small amount, 1 to 2%, we have also hemoglobin F, fetal hemoglobin. In pathological chains, there may be formed hemoglobin H, which include 4 beta chains. So that is the hemoglobin. Now let's look at the comparison of the blood cells. Pay attention, erythrocyte, the illustration, description, the shape, be concave, unnucleated, disc-shaped, and the amount. We have to know that in male, amount of erythrocytes approximately 6 millions per 1 milliliter of blood, but in women approximately 4.5 millions per 1 milliliter of blood. The lifespan of erythrocytes is approximately 120 days. Then they will express specific oligosaccharide molecules on their surface, and they will be phagocytosed by the macrophages of the spleen. Then they will be replenished by new population, which will be formed inside of the bone marrow. Then the leukocyte. Leukocyte is a white blood cells, and their amount is less than in erythrocytes. They are considered approximately from 4.8 to 10,000 per 1 milliliter of blood. And so they are less in amount. They just circulate within the blood because their main functions are inside of the tissues. When they receive signal, they leave blood circulation via the process which is called diapedesis, and they will perform their protective, defensive functions inside of the tissues. The leukocytes, they have spherical shape, and they are subdivided into 2 categories. These are granulocytes, which include neutrophils, basophils, and eosinophils, and agranulocytes. These are lymphocytes and monocytes. Let's look first of all at the neutrophil. Neutrophil, it's approximately 70% of all of the leukocytes, and pay attention to its nucleus. Its nucleus includes 2 to 3 lobes. That's why it's called polymorphonuclear leukocyte. Besides them, eosinophils, not just neutrophils, eosinophils and basophils also belong to polymorphonuclear leukocytes because their nuclei include many lobes, fragments. These are like segments. They are connected via thin threads. Then we are looking at its multi-lobed nucleus, cytoplasmic granules. They will include 3 kinds of granules. They are specific granules which contain antibacterial substances. Then they include azurophilic granules, which are lysosomes that contain oxidative and hydrolytic enzymes. Then they include tertiary granules, which contain gelatinase, catepsins. Main function of neutrophils, they also called macrophages because they also have ability for phagocytosing, and these are the first cells which will arise at the place of invasion of some foreign substances into the body. On that region, first of all, will arrive neutrophils, and they will leave bloodstream, and they have high ability for movement via their pseudopodia. So neutrophils, their lifespan is 6 hours. to a few days. It depends on the functioning and on the state of the body. Main function for the phagocytosing of bacteria, because on their surface they have Fc receptors for antibodies and complement proteins. They will assist these cells to perform the phagocytosing functions. Then eosinophils. Eosinophils, they have beloved nucleus, and in their cytoplasm you will find the granules which have elongated shape. They have dense crystalline-like core, and inside of their granules we will find histaminase enzymes which will break histamine, that is, the mediator of inflammation. Then they will include major basic protein of eosinophils, and neurotoxin, eosinophilic neurotoxin. These substances will kill parasites. So because they have this antiparasitary components, this major basic protein, for example, and neurotoxin eosinophilic, they will kill parasites. That's why their amount will increase in parasitary infections. Also, they will arrive at the place of inflammation, allergic reactions in later stages. And because they produce histaminase, they will break histamine. That's why their amount will also increase in allergic reactions, remember. Now let's go to the next type of cell. By the way, eosinophils, they constitute approximately from 1 to 5% of all of the leukocytes. Basophils, they, as implies the name, their specific granules will be stained by the basic stains. If eosinophils stained by eosin, that is acid stain, because its components are basic components, that's why it will attract basic stains, eosinophils. But basophils, because they are components of the specific granules, they actually in nature there are acids, that's why they will attract basic stains, and they will color into blue color by methylene blue, which we used for staining of the blood smear. And they have two bilobed nucleus. Their lifespan also from several hours to several days. It depends on the state of the body. They constitute less than 1% of all of the leukocytes. The content of the specific granules, these are histamine, heparin, chondroitin sulfate, aryl sulfatases, neutral proteases, eosinophil chemotactic factor, neutrophil chemotactic factor. So their functions same like in mast cells of the connective tissue. Next type, these are agranulocytes, lymphocytes. Lymphocytes, they, as you can see here, their cytoplasm is occupied by a large nucleus that is surrounded by a very thin rim of cytoplasm. They are approximately 15 to 25% of all leukocytes. We can distinguish three types of lymphocytes in blood stream, in blood circulation. They are T lymphocytes, which participate in cell-mediated immunity, then B lymphocytes, which participate in humoral immunity, and null cells. The null cells, they are actually stem cells and natural killer cells. These are populations of lymphocytes. More wide information about it, you will listen in the lecture of immune system on next semester. Okay, so that was the lymphocytes. Now let's talk about the monocytes. Monocytes, these are, as you can see here, largest cells of the blood circulation. Their amount will be from 2 to 10% of all leukocytes, and they circulate within the blood circulation several days to some months. Then, upon receiving signal, they leave bloodstream and will differentiate into macrophages. If you remember, I told you in previous lectures that we have macrophage mononuclear phagocytic system. These are the population of cells which originated from the monocytes of blood. Okay, so when they differentiate into macrophages, their main function will be phagocytosing. Then platelets. Platelets, these are actually not cells. These are fragments of cells, of megakaryocytes which reside in the bone marrow, and they detach from those cells and enter blood circulation to perform their function in blood clotting, coagulation of blood. The approximately amount will be from 150 to 400,000 per 1 milliliter of blood. Chemotactic agents that released in the site of damaged tissue by mast cells, they will attract neutrophils to the site of inflammation. Here, actually, some chemokines, some interleukin-1 tumor necrosis factor, which is produced by the surrounding damaged tissue, will induce endothelial cells of the blood vessels. Here, the endothelial cell that cover this capillary, for example. The endothelial cells will express, in response to those chemical agents, they will express intercellular adhesion molecules. And the circulating neutrophils, pay attention, these are cells which circulate within the bloodstream. They will adhere to the vessel wall, and by the, first of all, selectins, then the integrins, they will adhere to the endothelial lining. Then they will release their cathepsins from their tertiary granules, and these cathepsins will destroy the basal lamina, which located under the endothelial cells, and they will facilitate diapedesis. After, neutrophils will migrate between these endothelial cells and will migrate directly towards the damaged tissue site. Here, they will release from their granules, they will release antibacterial substances which will kill bacteria. Then they will phagocytose that bacteria because they have on the surface receptors, F4, Fc fragment of antibodies, then of the complement proteins. Due to this receptor, they will be able to phagocytose that bacteria. When they phagocytose, in the cytoplasm is formed heterophagosomes, and the content of azurophilic granules, because these are lysosomes actually, the lysosomal enzymes will be discharged into those phagosomes to kill bacteria. Then from specific granules will be released antibacterial substances. Also will be released oxygen radicals. This is superoxide anion, hydrogen peroxide, and hypochloric acid that will destroy the bacteria. So after killing bacteria, the neutrophils will die, and together with the dead bacteria, extracellular fluid inside of the damaged tissue will be formed pus. Now we will look at the megakaryocyte. Pay attention, the fragments of which that they form the platelets. The platelet structure we will look at the next illustration. Platelets, as you know, that's fragments. That's why they do not have any nucleus, and pay attention, they have disc shape. In the center we can see granulomere. Granulomere include granules, also organelles, the mitochondrial peroxisomes, and glycogen granules. Pay attention. The granules here of three types. These are alpha granules, lambda, and delta granules. They contain clotting factors which are needed for the clot formation. And also because the periphery of the cell contain hyaluromere. Hyalomere, that is the pale staining region, and here you will find the actin, myosin filaments, then the microtubules, and here we have two systems: dense tubular system which have not connection with the outside, and the open canalicular system. Open canalicular system, that is that are the canals which have connection with the outside of the cell. By that way they increase surface area of the cell membrane and facilitate release of the clotting factors outside to assist clot formation. Here you will see the electromicroscopic representation of the megakaryocyte. The granules inside, you can see here the glycogen granules, mitochondria, and here that is the also section of the platelet. And when the damaged vessel, we can see here that when blood vessel wall will be damaged, on that case from the damaged tissue and from the platelets and inside of the from the plasma will be activated clotting factors, and they will facilitate formation of the clot fibrin fibers you will see here, and they will finally activated platelets will form the clot, which will minimize loss of the blood from the damaged vessel. Okay, that was all from about the blood. Now let's come to the supporting tissues of the human body. That is also type of specific connective tissues, that is the cartilage. You know that the cartilage, it is supporting tissue which the cartilage, it is a tissue which devoid of the nerve endings and the blood vessels, so it is avascular. It means that it needs nutrition and taking the blood supply and immunological supply from the surrounding tissue, from the surrounding components. It will be provided by epicondrium, which cover the cartilage, and also in some areas, for example in articular surfaces, whereas the perichondrium is not present, there will be from the synovial fluid. Cartilage also have very poor ability for regeneration. Okay, so remember this one also. In the human body, we have three kinds of cartilage, that is hyaline, elastic, and fibrocartilage. The hyaline cartilage is mostly prevalent in the human body. We can find in many places, mainly in the airways, in the wall of the trachea, bronchi, then in also most of the cartilage of the nose and the articular surfaces of joints form the hyaline cartilage. And here you can see it. So as I told you, the cartilage is covered by perichondrium. Perichondrium will have two layers, outer fibrous, which include fibroblasts, then the fibers, and it is richly vascularized. Then the second layer of perichondrium will be cellular, and here we will find the chondrogenic cells. So the chondrogenic cells will give rise to cells of the cartilage. They will be chondroblasts that located under the perichondrium, elongated shaped cells. Then chondroblasts will be converted into chondrocytes. Here they are rounded cells. When the chondroblasts produce extracellular matrix components of the cartilage, they become rounded cells and they differentiate into chondrocyte cells. Then we are looking at the elastic cartilage. Elastic, it has the same principal structural organization. Elastic cartilage we can find in epiglottis, some of the cartilage of the larynx, then in pinna of the outer ear. That is elastic cartilage. It is characterized by abundance of the elastic fibers, which impart the yellowish color, opaque yellowish color to the cartilage. And also here the cells are larger and most numerous than in hyaline cartilage. Then we are looking at the fibrocartilage. Fibrocartilage, it resembles tendon in that it rich in collagen fiber bundles, which form parallel arrangement inside of the fibrocartilage. Between the bundles of the collagen, we can see the chondrocyte cells. We have to know that chondrocytes, they occupy some spaces which called lacunae pay attention, these are like lakes inside of the cartilage. That is specific feature of this tissue. So these lakes or lacunae will contain the cartilage cells, chondrocytes. They may located here when the chondrocytes occupy these spaces, they may undergo division and give rise to more cells, and all of these cells will located inside of these lacunae. This will form isogenic groups. Isogenic groups, it means that cells which originated from the same cell. If we are talking about the function, so the hyaline cartilage, it is the main function, it is shock absorber, and also it because it covers the articular surfaces and it forms smooth surface. By that way it reduces frictional forces which is needed for proper movement. Elastic cartilage will provide shape and it will form support. And then fibrocartilage, it also shock absorber and it will provide resilience. That is very important for the cartilage functioning. Fibrocartilage we can find in intervertebral discs, in pubic symphysis, in menisci, in those regions where is more important the functioning of the cartilage as shock absorber. It will carry the weight of the body if we are talking about the intervertebral discs. And the problems in this composition of the cartilage may lead to hernia of the disc, which will then, if we are talking about intervertebral discs, it may compress the nerves, spinal nerves, which course through those regions and will cause strong pain. If we are if we will talk about the structure of the cartilage from inside, we have to tell about its composition, that besides cells just I mentioned, it also includes extracellular matrix, which is rich here, and it rich in collagen fibers, which provide strength to this tissue, elastic fibers, which will provide its elasticity, its flexibility. Then about the extracellular ground substance, we can talk about the glycosaminoglycans like chondroitin sulfates, then proteoglycans, aggrecan, mainly aggrecans present here, which resist forces of compression. Then collagen fibers here, second type, also 9th, 10th and 11th type also is found here. Then glycoproteins, mainly chondronectin is present here, that are the extracellular matrix components. The matrix we can subdivide into 3 regions will be territorial matrix, which surround the isogenic groups. That will be territorial matrix, and between the groups will be interterritorial matrix. Then we will have capsular matrix, which immediately surround these isogenic groups, and they have basal lamina-like structure. They will provide support for these cells, chondrocytes. If territorial matrix that will be around, we will find it around the chondrocytes. Let's look here, pay attention, around the isogenic groups. We will see that that matrix is darker in appearance because it rich in proteoglycans, but interterritorial matrix will have more light appearance, more pinkish appearance, and it will rich in collagen fibers. About the cartilage formation, there are 2 types of growth of cartilage: the appositional growth from the perichondrium and the interstitial growth. Interstitial growth will mean the division of the isogenic the cells, chondrocytes inside of the isogenic groups. Then the isogenic groups will subdivide it into 2-3 compartments, and the cells will push away from each other, separate from each other, and they will form new isogenic groups. Also, these cells produce extracellular matrix components where they become entrapped, and that is interstitial growth. Interstitial growth will be more mostly we will see in the cartilage which do not covered by perichondrium, in articular surfaces, for example, of the joints. And oppositional growth, it is the growth from periphery, from the cell chondrogenic cells which present in perichondrium. They will create new generations of chondroblasts, which will then later will be converted into the chondrocytes. If we are talking about the development, the cartilage develops from the mesenchyme as all of the connective tissue types. There they will form chondrogenic islands, and the cells will become gradually they will become the chondrocytes. Let's talk about the bone tissue. Bone also the supporting tissue of the body, and it performs support. It is the structural support of the body. It forms the skeleton. If we are talking about the chemical composition of the bone tissue, here the 65% of the weight is constitute inorganic substances. These are calcium hydroxyapatite crystals. Then the remainder portion, there is the organic matrix and the water. From organic substances, 80–90% is constitute collagen fibers, which provide strength of the bone. And also here present organic ground substance components. These are glycoproteins like osteonectin, osteopontin. Then here present proteoglycans and glycosaminoglycans. If we are talking about the cells of bone tissue, here present osteoprogenitor cells, which are bone forming cells. Then they will differentiate into osteoblasts, and they will differentiate into the osteocyte cells. Here you can see the osteocytes which have processes, and osteocytes they occupy lacunae as in cartilage cells. They are located inside of the lacunae. Between the lacunae we will have canaliculi. Inside of the canaliculi will located their processes, and by that way the processes will communicate with each other. The processes of one cell and other cell, they will contact each other inside of the canaliculi. So inside of the bone tissue you will see the cellular lacunar canalicular system that is filled with the tissue fluid. Bone as a cartilage also covered by periosteum. If there were perichondrium, here we will see periosteum. Pay attention, it also has two layers, and under the periosteum we will have the bone tissue. So if we are talking about the structure of the bone tissue, we have to know that there are two types of bony tissue. First of all, that is the primary bone tissue or woven bone tissue, which is present in embryo, also where if the bone remodeling is taking place. So in the first stage will be developed the primary bone, then it will be replaced by the secondary bone tissue. So here in the illustration you can see the secondary bone tissue or lamella bone tissue that we have in our body in adult human. There is the secondary bone tissue. The structure of the secondary bone, as we can see here, it is composed of the concentric lamella. Pay attention, these lamella, they will form the concentric systems, which we'll call Haversian systems. Pay attention, this one Haversian system, that is neighbor one, and that is the third one. In the center of the Haversian system, we will have channel, that is Haversian channel, which carry, there is a loose connective tissue which carry blood vessel here. The nerves will be present here. Because the bone tissue, it is hard tissue, it will not provide diffusion of the nutritive substances through it, as in cartilage. If the cartilage is nourished by diffusion of the nutritive substances from the surrounding tissue, but in the bone tissue it is impossible. That's why here we will have channels. It is vascularized tissue. The channels which contain this Haversian channel, which include blood vessels. Also, in the periosteum we have blood vessels, but how they will communicate with each other? For that reason, inside of the bone you will see transverse channels which are called Volkmann's channels. Pay attention, they will connect these channels to each other. By that way, the blood vessels will communicate with each other, blood vessels, the periosteum, and these Haversian systems. Inside of the Haversian system, we will find approximately 20 lamella. All of them will take their nourishment from this central blood vessel, which is present in this channel. Then that is the surface of the bone. If it is long bone section, we have to know that in the bone we will find two kinds of the bony substance, that is cancellose or trabecular or spongy bony substance, and the compact bony substance. And functional unit of the lamellar bone tissue, that are the lamella. Each lamella composed of the bundles of collagen fibers which have parallel to each other orientation inside of the one lamella, but in neighbor lamella they will have oblique orientation. That's why it will resist forces of compression, and it will distribute these these forces in all directions. That is important for functioning of the bone. Then here we can see the besides this lamella which form the Haversian systems, we have outer circumferential, inner circumferential lamella, which will if outer circumferential lamella located under the periosteum, then the inner circumferential lamella will located under the endosteum. You know that inner surface, the medullar cavity of the bones, long bones, are covered by endosteum. So under the endosteum we will have inner circumferential lamella. Then now let's look at the woven bone tissue, that is primary bone tissue. It lacks lamellar structure. Pay attention. Then that bundles of collagen fibers here run in various directions through the matrix, and all the immature bone that is formed during the prenatal life is subsequently replaced by the mature bone. That bone also will be formed during remodeling of the bone. You have to know that throughout the life of the person, the bone undergo remodeling. It is resorbed by its cells, which called osteoclast cells. They are monocyte derived cells, and they continuously then replaced by new portions of the bone, which is produced by osteoprogenitor cells, then osteoblast and osteocyte cells. Now let's look at the internal structure of the histological section of the one Haversian system. Here you can see that the lumen of this Haversian canal is covered by the complex of cells, which is osteoprogenitor cells. Here you can find osteoblasts, osteocytes, and osteoclasts. These are the cells of blood. Pay attention. All of them you can find here. And here you can see the osteoprogenitor cells. As I told you, they are bony. These are like stem cells of the bone tissue, and they will differentiate into other cells. But pay attention, the osteoclasts, which are bone resorbing cells, they do not develop from the osteoprogenitor cells. They take their origin from the monocytes of blood. Pay attention to osteoclasts here, how they resorb the bone tissue. For that reason, they attach to the surface of the bone very firmly, and here you will distinguish some formation of some lumen, which was called Howship's lacuna. The cells will produce acid. The acid will destroy mineralized mineral component, inorganic components of the bone. Then lysosomal enzymes will be released, and they will resorb bone. The resorbed bony substance will be endocytosed by osteoclast cells, and the bony components will be released into the blood circulation. That is very important in supplying of the blood with the calcium. You know that the bone tissue, it is also depot for calcium ions. It will store the calcium ions, and when it is needed for the cells of the body, osteoclasts will receive signal, and they will resorb some portion of the bone to supply the body with the calcium ions. Then the bone formation. There are two types of bone formation. First of all, intramembranous bone formation. It is for flat bones. And in this process occurs in the richly vascularized mesenchymal tissue, where will be formed skeletogenic islands, and the mesenchymal cells gradually will be develop into osteoprogenitor cells, and finally into the osteocytes, which will elaborate the matrix of the bone. They will develop the primary bone, then will be replaced by the secondary bone tissue. And finally, development of the long bones. For the long bones, first of all, we'll develop the cartilage template, which is composed of the hyaline cartilage. Then it will be by the formation of the primary ossification centers. Here in the diaphysis regions of this template will be formed bony collar, that is primary ossification center. Then the cartilage cells will degenerate here. The blood vessels that penetrate into the cartilage will carry here osteogenic bud, which contain osteoprogenitor cells and all of the cells which needed for the bone formation, which here will produce a bony tissue. So the cartilage gradually will replace with the bone tissue, and the calcification will take place here. Then the secondary ossification centers will be formed in the epiphyseal regions, but their single region which do not undergo ossification will be the epiphyseal plate that will serve for elongation of the long bones, that is located between the epiphysis and diaphysis of the long bones, and it will supply new cells for the growth of the bones till the 22-21 years age for them. Then it will replace by the bone, so it will mean the stop of the growth of the person. So it was the connective tissue lecture. We finish, dear students. Thank you for your attention.